Yeah, this one? This room? Yeah, oh, can I just go in? Okay. Oh, wow. Oh my goodness, hey, Miss Coma girl. Hey, she can hear me? Or... Oh, okay. Yeah, so the doctors think that you might be able to hear me right now. But we don't know. We don't know if you can hear me, so I might just be talking to a corpse. Oh, I got you something since you're in a coma. I don't really know if you can use them or not, but I can help you out here. Yeah, I got you these flowers. Yeah, they're kind of dead, but so are you. So I got you this vase for the flowers. It looks like this. And then if we take these and we just kind of put them in here, we can just kind of put where you here. No, you can't tell me, so I'm actually just gonna assume you want them over here. Wow. Yeah, no, I got them last week. So they're kind of falling apart. It's kind of like, it's a little dirty in here now, but I mean, yeah, I'm really sorry that your heart surgeon sucked. Yeah. I don't know what I would do if I was in a coma, you know? I mean, I'd probably just lay there, but I don't even know what I would do if I was you and I was told, oh, you had a heart attack, and oh, we got this surgeon who's the best in the world, and then it turned out that you're like in a coma now. Like, I don't even get it, but you know Saturday was my 23rd birthday, right? And I don't know why you had to have a coma for my 23rd birthday. And I know you can't say sorry because you're in a coma, but I know that you're thinking it in your heart. Oh, I got you this, look what I got from the cafeteria for you. A Play of Vibe Sparkling Pina Colada Edition. Wow. It's an energy drink. Yeah, and I was thinking that with your little pipe here, we could put this into your little IV thing, and it could give you some more energy. Yeah. What do you think? Yeah, no, I don't know. I get a feeling that you're all for it, you know. So I'm actually just doctors out there and stuff. Okay. Wait, I'm just gonna quick have it. Okay. I'm just gonna put this here, and then do you mind if I just quick take your IV, actually? I'm gonna take this and I'm just gonna put it. I'm gonna take the IV and it's already attached to you, so I'm just gonna put it in the energy drink, and then maybe that'll help you wake up, you know? Okay, here. How's that make you feel? Do you feel better? Okay. Do you feel more energetic? I don't know because you can't respond, so we'll give that a minute. Yeah. No, you missed the whole party the other night. Last night was literally a movie. I just can't believe you missed it. Yeah, Brad was there. Yeah. He asked about you, actually. Like, he's with me, but he said, "Oh, how's your coma friend doing?" And I said, "I don't know. She's probably sleeping, because you know that's what people in comas do, right?" Yeah. Oh, also, now I know the doctor's gonna be in a minute, so I gotta give you these quick, because I don't know if they think these are good for your health or not, but I actually brought you one more treat. Yeah. Let me just move this out of the way. Okay. And look what I brought you. Your favorite Trader Joe's baked cheese crunchies, cheese flavored corn snacks. Yeah. I've already eaten a lot of them, but I thought I could help you have a couple since I know how much you love these. Yeah. Okay. Okay. Open wide. Here. Oh. I'm gonna put it in your mouth. Okay. Is that good? Okay, wait. Oh, this is a big one. Ready? Okay, I'm gonna put this in your mouth. Okay. Oh, the doctor's coming in. Hi. Yeah, sorry, I gotta go. I don't really like doctors, but I hope that your coma is good. I hope you have a good coma for me. Okay. Bye. Hi. It's me. Your new doctor. Sorry to interrupt. It's nice to meet you. There's a 60% chance that you can hear me right now, so I am Dr. Carolson. Dr. Mary Carolson. And it's nice to meet you. Here, I'll just shake your limp hand. I'm sorry that you're in a coma. I'm sorry in the sense that I wouldn't want it to happen to me. I am, however, not sorry, as in I take personal responsibility for your septic state, because the perpetrator of that action would be my colleague, Dr. Woodsworth. Yeah, he was. It turns out he was entirely unqualified to perform open heart surgery, emergency open heart cardiac surgery. Therefore, you have now entered a state of septic shock and a medically induced coma induced by medical problems, not by medical professionals, but we are working our absolute hardest in this emergency unit to bring you back out of your coma state. First off is a matter of legal importance. Dr. Woodsworth is incredibly sorry for putting you into a state of medical peril, and the hospital is having us give you a form to sign so that we can continue to provide you care. Assuming that you would like continued care, we have a non-disclosure agreement for you to sign. The non-disclosure agreement encompasses any legal hypothetical medical malpractice claims, and liberates the hospital from any legal action and any slander regarding qualifications of medical professionals. I'm going to take your hands, because in order to have continued care, you need to sign this form for us. So I'm going to grab your hand here and have you sign this non-disclosure agreement. Okay. Okay. Oh, you're cold. Your hand's cold. Okay. What was your name again? Okay. You have a long name. Yeah. Is that what your signature looks like? Yeah, you can't see it. You're in a coma, so thank you for doing that. Now that that's out of the way, why is your IV hooked up to a can of the energy drink Celsius? Okay. Yeah, no, you can't answer me, but I can hypothesize and speculate that it was your nurse, Emily Michelson, who did that. As she is a nurse in training on the emergency floor, and there was no nurse on floor to provide her supervision. Under the false assumption that an energy drink would provide you healing. So I am going to remove your IV actually from that can of Celsius, and I'll fix this later, but I'm making an executive decision to perform all of your care duties myself, not just the procedure, but also any menial daily life tasks of daily life in a coma that Emily, the incompetent nurse, would have performed on you. So I'll deal with that in a minute. The nurse Emily would typically brush your teeth, so I'm going to aid you in your horrendous breath, your coma breath. Yes. It looks that over here we have some Colgate Optic White Advanced removes 5 years of stains. So this toothpaste will make your teeth nice and white, either for when you wake up out of the coma or a potential viewing in your open casket funeral. Okay, so we have this toothbrush. Yeah, just get a bit of that onto there. And I'm just briefly going to brush your teeth for you here. Yeah, be careful. You don't want that going, entering your superior lateral trachea. Yeah, no. Yeah, if you could contract your epiglottis for me, that would be very appreciated. Okay, that's good enough for your breath. We can find you another nurse to give you a cleaning in the future. I'm just going to wipe your mouth as you are. You are in fact currently releasing some salivary secretions. Okay, that's below my pay grade. Enough of that. As for your catheter, I'll briefly empty your catheter bag. Here's a adult baby wipe. I'll just wipe the area after I remove the catheter from the pubic area. Here, hold still. Oh, you can't move. A little bit of doctor humor. Okay. Okay, yeah. No, they all look like IVs. Don't worry about it. Okay, I'll wipe this down. And empty your catheter bag here. Yeah, there's a trash can over there for your catheter secretions. I'm going to reinsert this. I would say hold still, but you don't have any other options. hand. Reattach the bag. Reattach. Okay, you're doing wonderful. Not that you have the choice to do awful. You're holding still. Very nice. Very nice for me here. Sorry, just a bit of doctor humor, doctor jokes. I'll wipe you, clean the area with this. All right. Now that you have had all of your nursely actions, daily continued coma care, routine performed on you, I as your Dr. Carolson, will be performing your wound check and septic bacterium removal procedure. Yeah. Our first step is I'm going to look at your wound of your heart. Oh yeah, look at that pump. Look at that blood pump. I'll first be sterilizing the area with this medical grade alcohol prep pad. You are plenty sterilized at this point. I will be applying the numbing lotion. Alright, oh my. Gloves are being all fun here. Next up, I need you to wait a moment as the numbing cream sets in. In the meantime, how's the coma treating you? Yeah. No, I didn't think you could talk, but it's always not medically possible that you could talk in a coma. If we keep innovating and testing the possibilities of medical science. I will touch the heart area here to see if we're plenty numb, and if you feel anything, your body will start convulsing out of autonomic nervous system reflexive pain. So I'll test you here. Could you feel anything? I'm assuming no, as you are still limp and lifeless. Okay. Here I have the injection of the injected heart serum. I'll have you know that if you start to experience some hallucinations or the tripping, as the kids call it, that is a known side effect of this hydrochlorothiroxycardiacazine injection. Okay. Yeah. Well, again, I would say hold still. Hold still, but you don't have a choice. That's my favorite joke to make with coma patients. Here goes. Here goes. Okay. Okay. Yeah, no, nothing's happening, but I assume that the hydrochlorothiazakazine was injected into your aortic pulmonary aortic artery, and now it should be entering the carotid-jugular apparatus and spreading throughout the vascular network. Okay. Discard that in the sharp spin. And, now that your injection has been completed, you may be beginning to feel some hallucinogenic symptoms. I don't know what to say about that. We're doing everything in our care here to help you out of this coma. But Dr. Woodsworth really put you in deep here when he left the aortic artery susceptible to the bacterium in the air, and they got into your aortic vessel and caused an infection. So the infection, a heart infection. Yeah, with the mycobacterium growth on your pericardial wall. Just an unfortunate situation altogether. So, okay. So, well, you should be getting very sleepy as the effects of the hydrochlorothiazide kick into your jugular veins and capillary arteries. So I will see you again, hopefully when you are able to respond back to me. If not, I will inject you with more hydrochlorothiazine. And I look forward to being able to chat with you when you can respond to me, and just remember that you signed that non-disclosure agreement, so you can't say anything to any uninvolved parties regarding this septic incident. I hope that your coma is treating you well, and I believe you should be getting very sleepy now due to the cardiac cules molecule in the medication. So, I've spent enough of my precious time with you. So, well, if you're not already asleep, I wish you best of luck with your coma. Okay. Yeah. No. Good night. Good night.
Thank you so much for listening. If you enjoyed, feel free to click on another one. And this is your reminder to prepare for upcoming ads. Have a good rest.